Welcome to JF Nursing Class. Today in this video we'll discuss about the auscultation site for different areas of the heart. Means in different areas of the heart, how we are able to auscultation. So first one is for aortic valve area, all the things we can auscultate. So in aortic valve area, second, so aortic valve, if you want to auscultate the aortic valve area, so where we should auscultate? Second right intercostal space, right sternal border. So normal, if you want to auscultate the aortic valve area, then we have to go for second right intercostal space. This is the aortic valve is the this is the aortic valve area. So you have to auscultate in second right intercostal space. This is the second. This is the first intercostal space. This is the second right intercostal space. Right external border. This is the sternal border. This is the right external border. Here we can auscultate aortic valve area. So this is the area. This is the second right intercostal space. Right external border. Here we can auscultate aortic valve. Then second is the pulmonary valve area. So pulmonary valve area, here we can auscultate by the pulmonary valve area. The second left intercostal space, the sternal border. So here you can see this is the first internal space, second internal space. So this second internal space, second left intercostal space, left external border. Here you can auscultate the pulmonary valve, aortic valve, and pulmonary valve area auscultation is done. Then arch point we can auscultate third left intercostal space, left external border. In third left intercostal space we can left intercostal border. Here we can auscultate the arch point. Then tricuspid valve area we can auscultate fourth left intercostal space. This is the fourth left intercostal space. Here we can auscultate the tricuspid valve, the left external border. This is the left external border. We can auscultate the tricuspid valve. Then mitral valve area. This is the mitral valve area. We can auscultate on fifth intercostal space. This is the fifth intercostal space, left mid clavicular line. This is the clavicular line with the mid clavicular line along the mid clavicular line, and fifth intercostal space. So we can auscultate the mitral valve or apical area. Mitral valve area or apical area we can auscultate. Mitral valve area or the apical area we can auscultate here. Then Gibson's area we can auscultate on left first intercostal space. So this is the left first intercostal space. We can auscultate the Gibson's area. Patent ductus arteriosus is heart here. Normally patent ductus arteriosus is auscultated on Gibson's space, which is present in left first intercostal space. We can auscultate. So this is all the picture. As you can see here, this is the Gibson's spine, which is present on first left intercostal space. Okay, here normally PDA we can auscultate. This is the aortic valve area. This is the right intercostal, right second intercostal space, right external border. Then this pulmonary valve area. This is we can auscultate on left second intercostal space, left external border. Then this absum we can auscultate on third intercostal space, left intestinal border. Then tricuspid valve area we can auscultate on fourth intercostal space, left intestinal border. And this Gibson's area we can auscultate in the first left intercostal space. And in this mitral valve or this apical area we can auscultate on fifth left intercostal space in mid clavicular line. This is in this mid clavicular line. So this is all.